What if I told you that some pregnancy complications give warning signs, but many women ignore them? What if I told you that simple things like blood pressure checks, kick counts, or even sleeping position can save a baby's life? Pregnancy is beautiful, it is powerful, it is sacred, but it is also one of the most physiologically demanding processes a woman's body will ever go through. Today, we are talking about 10 serious pregnancy complications, what causes them, how they happen inside the body, their warning signs, and most importantly, how to reduce your risk. This is not to scare you, this is to equip you, because knowledge in pregnancy is protection. Before we dive in, subscribe to this channel for evidence-based women's health education. Like this video so more women can see it, and share it with a sister, wife, friend, or mother, because this information can literally save lives. Now let's begin. 1. Ectopic pregnancy. An ectopic pregnancy happens when the fertilized egg implants outside the uterus, most commonly in the fallopian tube. The fallopian tube is not designed to stretch like the uterus. As the embryo grows, the tube can rupture, causing internal bleeding. Why it happens: previous pelvic infections, untreated sexually transmitted infections, previous ectopic pregnancy, tubal surgery, smoking warning signs, sharp lower abdominal pain, shoulder tip pain, vaginal spotting, dizziness or fainting prevention, early treatment of infections, avoid smoking, early ultrasound at 5 to 7 weeks if high risk management, if caught early, medication, methotrexate. If ruptured, emergency surgery. Early antenatal booking saves lives here. 2. Miscarriage. Miscarriage is pregnancy loss before 20 weeks. Most early miscarriages happen due to chromosomal abnormalities, not because the woman did something wrong. Risk factors: uncontrolled diabetes, thyroid disorders, severe infections, hormonal imbalance, smoking and alcohol symptoms, vaginal bleeding, cramping, passing tissue. Prevention: pre-pregnancy health check, folic acid supplementation, chronic disease control, avoid alcohol and smoking. Recurrent miscarriage requires specialist evaluation. 3. Preeclampsia. This is one of the most dangerous pregnancy complications. It involves high blood pressure and damage to organs, especially the liver and kidneys, after 20 weeks. It begins at the placental level. Abnormal blood vessel development leads to poor blood flow, triggering systemic inflammation. Signs: severe headache, swelling of face, hands, blurred vision, upper abdominal pain, protein in urine. If untreated, it can progress to eclampsia, seizures in pregnancy. Prevention: early antenatal care, low-dose aspirin for high-risk women, weight control. Before pregnancy, BP monitoring management, blood pressure medication, magnesium sulfate, to prevent seizures. Delivery if severe delivery is the only cure. 4. Gestational diabetes. This happens when pregnancy hormones make the body resistant to insulin. High blood sugar affects both mother and baby. Risks: large baby, macrosomia, birth injuries, neonatal low blood sugar. Increased C-section risk prevention, healthy BMI before pregnancy, regular exercise, low refined sugar diet, screening at 24-28 weeks management. blood sugar monitoring, medical nutrition therapy, insulin if required. 5. Placenta previa. The placenta covers part or all of the cervix. When the cervix begins to open, bleeding occurs. Symptom: painless vaginal bleeding in late pregnancy. Risk factors: previous C-section, multiple pregnancies. Smoking prevention cannot be fully prevented. Management: pelvic rest, hospital monitoring, planned C-section. 6. Placental abruption. The placenta detaches from the uterus before delivery. This cuts oxygen supply to the baby. Symptoms: severe abdominal pain, vaginal bleeding, hard uterus. Prevention: control hypertension, avoid smoking, avoid trauma management, emergency delivery if severe. 7. Preterm labor starting too early. Premature babies may have breathing problems because lungs are immature. Prevention: treat infections early. Cervical cerclage if weak cervix, progesterone therapy in high-risk women. Stress reduction management, tocolytics to stop contractions. Steroid injections to mature babies' lungs. NICU support 8. Hyperemesis gravidarum, extreme vomiting beyond normal morning sickness. Leads to dehydration and electrolyte imbalance. Management: IV fluids, vitamin B6, antiemetics. Small frequent meals, early hospital care prevents complications. 9. Intrauterine growth restriction. The baby does not grow at expected rate, usually due to placental insufficiency. Prevention: stop smoking, manage hypertension, adequate nutrition, regular ultrasound monitoring. Management: close monitoring and possible early delivery. Stillbirth: loss of baby after 20 weeks. Risk reduction: monitor baby's movements, control chronic illness, sleep on-side in 3rd trimester, regular antenatal visits. Reduced fetal movement is an emergency. The biggest protection tools in pregnancy: early booking before 12 weeks, regular antenatal visits, balanced nutrition, chronic disease control, no smoking, alcohol report, warning signs immediately. Know your body. Pregnancy complications are not always preventable, but they are often manageable when detected early. Pregnancy is not just carrying a baby. It is a complex cardiovascular, metabolic, hormonal, and immune transformation. Women deserve information. Women deserve monitoring. Women deserve safe pregnancies. If this video educated you, like it. Comment "healthy pregnancy" if you learned something new. Share this with someone who needs it. And subscribe for more evidence-based women's health education. Because informed women raise healthier generations. See you in the next video.